Hi, I'm Dr. Rajani. Thanks for joining me today. You might regret getting dermal filler. Many people on this channel have had it, regret it. Many people are contemplating getting it. You're seeing some signs of aging and you're wondering, hey, should I get it? I'm going to give you 5 factors that might indicate that you are going to regret getting dermal filler, and I'm going to give you a few ways that you can avoid it to make sure you have the right mindset and you're going to be happy with it. Filler is a tool, it's absolutely amazing, but there are many regrets. I want you to avoid them. The number one reason people regret getting dermal filler is they come in for the hardest area to treat, one of the first areas that you see signs of aging, and that's the under eye. Fillers attract water. So by nature, you're putting something in a delicate area that's going to attract water and give you a baggy looking eye. And that is a disaster. And I have videos on dissolving the under eye. Remember the puffy face. People often see unnatural people and they say, I never want to get filler. They see the puffy face. And the puffy face comes because people either have too much or it draws water in, and people are trying to lift the face with filler. Filler doesn't lift the face, it's a gel, it volumizes. So don't go in to get filler for the number one area that's most difficult to treat and that's not built to have filler in it. The number 2 reason is the patient needs surgery. They're coming in at 50, 60, 70. There's significant sag. There's a jowl. And they're coming in for filler. And really the best treatment is at that point, not filler, because you lose a tablespoon of filler, 15 mLs, or 15 syringes by the age of what? Around 40. So to just put filler in the face when there's significant sag, skin damage, sun damage is a problem. And a lot of times when you go into a clinic, people don't want to say, oh, you're not a good candidate. We'll do a little filler, see if you're happy. You might regret it. The third one is expectations. When you go in for your filler, you saw an Instagram post, a TikToker, an influencer, and they had filler done. Their before and after looks amazing. And you go in with the mindset, I'm going to get filler. I'm going to have an outcome like that. You're going to see the best before and after pictures put up that anyone has, and in the best candidate. No one puts in filler failures in their before and afters. So your expectations for what 1, 2, or even 3 vials of filler, the average price is going to be about $2,000 for 3 vials of filler in the United States, is going to fall short. So the expectations might not be met, and that's the third problem of why you might regret getting fillers. Number 4, it's not a one and done. You don't just go get fillers and then you're good for 5 or 10 years. It's something people do over time. I have videos on filler migration, why fillers don't last, why you don't see results. You can watch all those videos, but it's a big regret of people. They go in, you might need more fillers in 6 months, in 3 months, in 1 year to meet your expectations of the volume that 1 to 3 vials is going to produce. That actually costs a bit of money, of course. Now, I think it's a great use of people's money to spend on their skin, but it's not a one and a done going to get fillers and you're good for a while. It's part of a program of maintenance. Finally, there's downtime, and most people aren't prepared for the downtime. And a good video to watch on that is the botched jawline, where I fill a jawline and it looks horrendous the minute after I fill it. Even for a day to 4 to 5 days, it doesn't look good. The patient wanted the crispest, sharpest jawline she could have, patient in her 50s, and to create that, there's going to be an element of downtime where it doesn't look good. Even a few injectors erroneously commented, boy, that looks too wide. The bigonial angle is too wide for the bizygomatic angle. And they're wrong. They came out perfectly. But I had to overdo it for a period of up to a week. And I have those pictures. I'll make a video of it for it to look good when it all settled in. Because it was a 50-year-old, not a 25-year-old. Very different patients. Downtime, bruising, people around you knowing you had something done. A little bit of overfilling you might have to deal with for a week or two to get a perfect result. Most people are not prepared and they regret having it done, and they regret that maybe people around them found out that they did something. Now, fillers can be great. I don't want to paint a bad picture, but they're part of a treatment plan. So what can you do to avoid regret? The first and most important thing that you can do is get a great consult. And I know everyone asks me on here in the comments, can you recommend someone in this town, in this town, in this city? And I can't recommend someone. You have to go. It's a very personal decision. Sit down with your provider and you're going to say, hey, what can you do for me? What are the options that I could do? And it's not just about the services that they might have available for you, the mindset of the practitioner, the mindset of the amount of product that might be appropriate for you, but also the time that you want to do it over. So we know it's not a one and done. You need to find someone that you look forward to going to that's straight up, that meets the price expectation for your desired outcome. And that initial consult can take 20 to 30 minutes at least to figure out if you're a good fit for that practitioner. So get 3 consults and make a decision. Who you see, what they know, how you get along is absolutely important to your outcome. Number 2, and almost just as important, is go for combinations. Remember, fillers are tools. They use and work with biostimulators, with radio frequency skin tightening, with chemical peels, with your topicals, with your PDO threads, everything that you see on this channel. Finally, don't go for the immediate effect. So don't go and get a treatment done just for the immediacy of something you have in a week or two, an event. These things work with all the aforementioned treatments over months to provide a beautiful canvas, angles, folds, and to create healthy glow to your skin. So try not to have an immediate knee-jerk reaction of going to get these treatments, but make it a culture and a lifestyle within what you do, your diet, your exercise, your sunscreen, all the preventive factors that we talk about. And I try and educate on this channel. I want to hear in the comments, what do you do? What's your biggest regret of getting fillers, if you have any? I put a complete playlist right up here on dermal fillers, all about them, longevity, dissolving, and everything you need to know. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.